our keynote speaker, State Representative Rosita Youngblood. She was first elected to serve in the Pennsylvania House of Representatives on April 19, 1994. Throughout her tenure, Youngblood continues to serve the constituents of the 198th Legislative District by introducing legislation that focuses on putting the people of Philadelphia and all of Pennsylvania first, and through sponsoring a variety of community outreach programs and activities. Rep. Youngblood has led the way in sponsoring proposals that help working families, children, and seniors while building a stronger economy and a better Pennsylvania for all. But we are especially proud, and I'm saying that not from the bio, because in November of 2014, Rep. Youngblood was elected by her peers as Secretary of the Pennsylvania House Democratic Caucus, becoming the first Black female to hold a leadership post in the Pennsylvania General Assembly's 300-plus history. Yes, we should applaud that.
Thank you. Good afternoon, everyone. It's a pleasure to be here today with you. And I guess you're saying, oh, they invited her? Does she really understand our plight? Oh, yes, I do. 100%. In 1994, I received a phone call and said, your stepdaughter just gave birth to a baby. I said, but I'm not married to her father anymore. A step-parent is always a step-parent. Can you please come to the hospital, the University of Pennsylvania, and pick this baby up? I said, wait a minute. I haven't had a child in 19 years, and you expect me to come and pick up a newborn baby on a Friday, and I have to be to work on Monday? Yes, we do, Miss Youngblood. I said, okay. Got my sisters together and my brother, and I said, I'm going to need some help. I have to go to work Monday morning. What am I going to do with a newborn baby? My niece agreed to watch him while I worked. My brother's a doctor and my sister's an RN. So we came together as a family. We went to the hospital, picked the baby up. I had to go out and buy a crib. Everything that you would need, and was an eye-opener. It was an eye-opener to the point I had no idea of how much Pampers cost or anything else or baby food. So I said, and I called back to the Department of Welfare, and I said, I need some help. Well, you can go get a welfare check. I said, I'm not going to get a welfare check, but there should be something in place to help caregivers when you're raising someone else's child, and especially since you told me that I am technically responsible because I was married to this man. So what we did was, when I finally got elected to the House of Representatives when he was 6 months old, I had him in one arm, a baby bottle in the other arm when I took the oath of office. And I continue with my family supporting me 100%. That baby today is 22 years old and has a child of his own, and I legally adopted him. And that's what prompted me to do Kinship Care Program. When I realized there was nothing out here to really help a caregiver taking care of children. It took me up into 2003 to get the legislation passed, and I talked to Governor Rendell. I had talked to other governors that were in office, but it wasn't a priority. Governor Rendell understood we need to help our caregivers raise these children because you have two options. They can become successful, or you can end up in a penal system, and you don't want a child or anybody to end up in our penal system. And I think it's important that we all work together in raising our kids. Pennsylvania is almost at epidemic proportions with children being raised by relatives, not only grandparents. And we need to try to do something to stop this. And by working together collectively, because I had my staff pull some stats. According to the 2010 census, Pennsylvania has 191,000 children, or about 7% of the children in the state are being raised by grandparents. The figure increased, and it's increasing every year. Nearly 20% of grand families live below poverty, and it should never have to happen that anybody has to live below poverty, and you can't get the things that you need to take care of yourself or the child. It needs to be a way that people don't feel that they're obligated to the system because they can't get help. And with this conference, it gives you the ability to come out and find out what's available and how you can get help. I always try to be a resource when people come to me, because I've had people come to me and said, oh, they dropped off my grandkids at my house from North Carolina, and I don't know what I'm supposed to do. I said, well, let's figure it out. First of all, you got to get legal custody so somebody don't come back and say, well, I'm claiming them. And we'll go from there in trying to help you. But there is a possibility, and I was talking to Marlene, I said, I'm getting tired of piecemeal legislation that is enacted to help people raising other folks' kids. We need something that is concrete that can assist everyone. Because, lo, by the grace of God, nobody knows when they're going to be in that situation that you're going to raise somebody else's child, that then becomes your child. And 9 times out of 10, the child's not going to leave you anyway. I know my grandsons, they know what their mother's name is, and I told them. They asked me where she was. I said, she said at your birth, and I have talked to her, that she could not afford to take care of both of you. And I respect her for honoring that and saying and realizing that she could not handle 2 twin babies or trying to and get herself together too. So I respect that 100%. And I'm very proud of the job that all of you are doing in raising children that will grow up to be outstanding young men and women. And I'd like to thank you for having me here today to address you. And also, I'm open to answer any questions you might have. Yes?
Hi, I'm Sheila Johnson. I'm asking about housing for grandparents.
There's a waiting list for Section 8 housing and voucher. At the last time, I think it might have been something like 30,000 people on it. They can't deviate on that list and give it to someone because you received a child. And what happens is there should be another option where people can get low-income housing. Yes?
I would also say that the Senator has been working for years in partnership with Grands' parents to try and get an intergenerational housing unit as a model established, and that just hasn't been able to get any steam out of the Senate.
Hi, my name is Karen Wright. I've been in kinship care for 17 years. I adopted him. And what I want to say, I heard you say utility bills going up, everything is going up.
There's a lot of things that you can get. Respite care when you need a rest. Do you get your dental, medical, food allotment, and clothing allotment?
I did want to, as a foster adoptive and kinship parent, I wanted to offer a resource if I could, because many of our children have behavioral health challenges, and that's another area for us. We don't know where to go, what to do. A lot of times our relatives also have behavioral health challenges. So the Department of Behavioral Health does have a wonderful website. So I just wanted to put that out there. It's real easy to visit. It's Healthy Minds Philly, healthymindsphilly.org. So I hope people will view that website, because there are a lot of free trainings for families, because you need to learn how to cope and stay well, even when others may not be. So I hope people will visit that website. But thank you again for the wonderful presentation.
You can also, in school, if they're in school or school age, the counselor are supposed to set up to have the evaluation done. No, well, if they didn't, you can sue. I'll tell you who you can call.
For 8 years, I knew nothing about kinship care. They gave me a letter when I left court, and that was all I got. So like yourself, I've been raising on, I was retired, so I had very little income, and I'm still doing it and still getting no help.
There is a difference. When they become a ward of the court, you're supposed to get the same per diems as a foster parent. The same thing. Well, you can go back, Chartan, have somebody talk with her because I don't understand how that happened.
For all y'all who don't know me, I'm Chartan Nelson from Grand Central. So what Rosita is talking about is when you are awarded a child through the court system, they should automatically offer you kinship care. And I'm going to say this because I know it's DHS funded and all the lovely things. But you know what they tell y'all? You don't want us coming to your house. You remember them people? How many people remember them saying that to you? You don't want them coming to your house. You don't want them in your business every week. So y'all say no. And when you say no, they run back to DHS and they send you a letter and close your case. That's why you didn't get the money. That's the good, the bad, and the ugly all mixed up in one.
Make sure, if you have any friends that are getting children that are awarded to the court, that they get kinship care. Because, first of all, there's not enough social workers in the city of Philadelphia to come to your house every week. Because I know when I got my daughter, she's 36, and I got her when they had saved the children from Ethiopia when they had the famine. And I got her through Lutheran Family Service. I think I might have seen a social worker twice. A social worker twice. And I was her foster parent and raised her, and now she's 36. And I had a member, when I think she graduated from high school, asked her, well, don't you want to go to Ethiopia and look up your mother and find your other people? She politely told him, Rosita C. Youngblood is my mother and the only mother that I've known. Because she was 4 years old when I received her. So children are dead, but you gotta stay on it. We're doing what we call a diaper drive. In my office in Harrisburg, we've collected over 5,000 cases of diapers, meaning Pampers, pull-ups, because there's a dire need, and also products for adults and children that have problems. So we call it incontinent adults that need Depends or people need other things. Philadelphia has a diaper bank. There is a diaper bank in Philadelphia, several areas. There are food pantries that give out Similac. Sally Watson on Wayne Avenue will give milk, baby food, and some other products. You may have to do a little research, but it's out there and available of what you can get. And with the school district, if you can't afford to buy the uniforms, tell them they're going to have to give you the money to get them, because I can't afford to constantly buy these uniforms. But there are avenues, and we try to build a resource network where we can avail to you the different areas where you can get help. And it's there. And I don't have the number on me to the Philadelphia diaper, but we can get it. Because I know I send people, because I even do it out in my district office. When we have a giveaway diapers, and I call them Pampers, and some other stuff and pull-ups and stuff, I usually have a line all the way around the corner going around, and within 20 minutes, we're out. That's how bad people need them for different things, even for adults. And like I had told somebody, we all going to get to the stage one day where we're going to need Depends. So don't think you're not. It's going to happen. So that's why we make sure we get the wipes, everything that you can use. Yes?
When you're doing kinship care, are you eligible for the home repair program like your windows, or if your roof start leaking, stuff like that?
Since Nutter is going out of office, he just opened up the weatherization program again for everybody. So look into it. Go to 1234 Market Street and apply for it.
If you look at the resource guide that you all were given, There is a lot of information about home repair, about food, all different categories of information that is in there that you can research and contact and see what you can find. With that, I want to thank Rep. Youngblood for her inspiring speech for us. She is certainly one of us. Thank you very much.